My name is Carmen. I'm the career champion of Conolly ward. My role is basically to support carers and families of our patients, obviously. And this came about, I think, is because during the pandemic, of course, we were not allowed visitors at all on the wards. And what we do is keep them updated with, any changes in the current treatment, and just keep them involved in the decisions and give them the importance that they deserve, because at the end of the day, they are the experts in our patients. No, of course, we are the mental health experts, but they are the experts in that specific person. Yeah, well, I think it's a very, very difficult time when a loved one is admitted to a inpatient unit, and it's very, very important that we get the feedback and from this person that knows them when they're well. So if we don't do that, it's one-sided, really. We're just seeing this person unwell and we don't know how they are. We don't know if they're making improvement. So their voices are just very, very important. And then again, their well-being is just as important as that of the patients. So we need to make sure that we keep them well as well, because if they become poorly, that might be another patient that we need to admit, and then we're going to have to be dealing with twice the work. And it's just it's very important. It's been demonstrated that if we involve the carer in the treatment of their loved ones, the chances of readmission are actually lower. So we're keeping them well for longer, and we're just doing our job better if we keep them involved. So my favorite part is to support people that it's their loved ones' first admission to the services at all. So this is the first time that they become unwell. They know nothing about mental health. It's all completely new, and it feels very daunting because it's just a lot to take in. So I have to make sure that they understand what's going to happen, the support that we're offering to the loved one, that they're going to be seen, once a week by the consultant, all the things that are happening in the ward. How is the ward some people even want to know, like, what is on the ward? Do they have a lounge? Do they have a TV? Do they have like a place where they can meet each other? How is the dorms? Things like that. So it depends. My usual contact with relatives generally is once a week, but with people like this, it tends to be more than that. It might be maybe twice a week, might even be every day. It depends on the needs of them, and they're always so grateful. They're always really, really grateful. Well, first of all, just don't try to handle the situation on your own. If it's taking too much out of you, if you feel like you can't manage, just look for help, really. There is loads of help, and a lot of people don't realize, really. They just think that they're expected to give up their life to look after someone because they love them. It doesn't have to be like that. Of course, it is a lot it's going to take a lot of you, but it doesn't have to be. It shouldn't be you having to give up your life to support this person. There's loads of support. If you are, if you're already part of the trust and you're really not coping well, contact the carer's email address or Carers First. There's a lot that they can do to support you. And at the end of the day, they need to realize that they need to look after themselves, because if they're not there to look after the loved ones, who's going to do it? And they're just as important as the loved ones. Do not put yourself in a second place, because you are just as important. Just for professionals, just always think that there's a person that's supporting your loved one most of the time, and you really need to make it as much as a priority as the patient, because they could be your patients. If we don't make sure that they're well, they might become patients at some point. They have huge amounts of pressure on them, and it's very important that we look after everyone.